Hello, everyone. My name is Isha,
My name is Cindy.
and we're going to be presenting on Ubrogepant.
So a little bit of an overview of Ubrogepant. It's an oral small molecule calcitosin gene-related peptide receptor antagonist. So there is both the alpha and the beta neuropeptide. Usually, this medication overall is taken orally. There's the 50 as well as the 100 milligrams. This medication was FDA approved in 2019 by Allergan under the license of Merck & Co. And then the main use for this medication is acute migraine treatment with or without aura, how in adults specifically. However, this medication is not for preventative; it's just pain relieving.
So, migraines are recurrent headaches with severe throbbing or pulsating pain on a certain area of your head. But migraine aura is visual disturbances that are accompanied by the migraine, including dots, sparks, or zigzags in your vision.
So the CGRP is a 37 amino acid neuropeptide. It is highly potent. It is a highly potent vacillator. It possesses protective mechanisms that are important for physiological and pathological conditions, including the cardiovascular system as well as wound healing. CGRP is primarily released in the sensory nerves. Thus, this is implicated in the pain pathways. Researchers actually suspect that blocking the CGRP can effectively treat migraine attacks in some people.
So CGRP causes hyperalgesia, which is extreme pain sensitivity, as well as allodynia, which is pain due to a stimulus that normally doesn't provoke pain, by triggering inflammation and increased neuronal responses to a stimulus. This hypersensitivity to pain is the cause of migraine pain and throbbing. Our drug acts as an antagonist for the CGPR receptors, which results in reduced migraine nociception.
So the treatment with the Ubrelvy, so Ubrogepant is a self-administered, as mentioned before, it's self-administered orally after the symptoms of migraines appear. So the recommended dose usually is 50 milligrams or 100 milligrams to be taken orally with or without food. If needed, if the symptoms continue, usually a second dose can be administered at least 2 hours from the initial dose. However, the maximum dose that you can do in a 24-hour period is 200 milligrams. Some of the side effects include nausea, fatigue, and dry mouth, and then some common allergic reactions may include swelling of the face, mouth, tongue, or throat.
There are two contraindications that result in higher levels of ubrogepant within the body. So the first one, cytochrome P53 inhibitors. So cytochrome P50 are enzymes in the liver that are important for the metabolism of various drugs. And so an inhibitor of this enzyme would result in a higher level of ubrogepant remaining unmetabolized within the body. And so a cytochrome inducer would have the opposite effect. And then the other contraindication is um, renal impairment in patients. So one of the routes of ubrogepant is cleared is via renally. So people that have renal impairment due to end-stage renal disease should not use ubrogepant. Also, high doses of ubrogepant resulted in embryo fetal mortality within pregnant rabbits, so it's not recommended for pregnant women.
The contradicting medication for Ubrogepant or Ubrelvy is Zavzpret. So Zavzpret is actually also a medication used to treat migraines. However, some of the key differences are that this specific medication is nasally administered rather than orally administered. There is a faster action onset, which is 15 minutes compared to the 1 hour with Ubrogepant. They're both, however, still part of the CGRP receptor antagonist and have the same mechanism of action. However, the Zavzpret does have fewer clinical trials conducted as well as fewer case studies since it was FDA approved this year. Um, as well as other things, Zavzpret also has severe side effects, including allergic reactions like hive, facial swelling, and trouble breathing, and then some other side effects like nausea, vomiting, or unusual taste due to the route of administration through the nose.